I'm going to introduce now our first guest, Associate Professor Malcolm McLeod, who works at Australian National University. His research interests include medicinal chemistry and the development of new chemical and analytical technologies to study drug metabolism. He is the chemistry lead for Pill Testing Australia and CanTEST. Professor McLeod was awarded a Churchill Fellowship in 2020 to study drug checking services in Europe and has just returned. Well, it was a couple of weeks now from a 6-week tour of these services, which I'd love, Malcolm, if you can start off by telling us about those experiences and your travel, and that was throughout Netherlands, Portugal, and Austria. Mal uses caffeine and alcohol, but not combined, as his drugs of choice. Mal, welcome.
So thanks very much for the introduction. I will kick off with the Churchill Fellowship there. So as Nick mentioned, I'm the chemistry lead for Pill Testing Australia and also for CanTEST. And the Churchill Fellowship was awarded so that we could advance the science of pill testing and drug checking in Australia. So I'll talk a bit about the Churchill Fellowship, and then I might dive into CanTEST and pill testing in Australia, in the Australian context. So let me just share a screen. I have some images that I can show you. It's a really bit of a dorky photo there, but this is me at the Trimbos Institute in the Netherlands, and this was my first point of call. So the Trimbos Institute run the DIMS drug checking network. So that's the Drug Information and Monitoring System, and it's a national network in the Netherlands doing drug checking. It's an interesting system. It's been working for over 30 years now to both check drugs for patrons, but also monitor the drug market in the Netherlands. And they have a amazingly well worked out systems. I spent a week there, basically hands-on, getting to grips with their methods and how they run their systems. And so there's plenty of learnings for me as a new drug checker. From there, I moved on to Portugal, and the first port of call, I guess, in Portugal was the Boom Festival. And this is a photo of the drug checking and drug info hub at the Boom Festival, run, of course, by Kosmicare. And so this was an amazing group of people, volunteers from around the world, who'd come to offer their services to both reduce the potential harms of drug use, I guess, but also to do the drug checking. And again, I was involved in that sort of over a week-long process there of testing the drugs for the patrons there. Of course, many of you will be aware that in addition to drug checking, Kosmicare also operate a psychedelic emergency hub, which is trying to, I guess, assist people who are having difficult experiences on psychedelic drugs. And this service has again been running for many years now, and is underpinned by quite a lot of work and study. They have detailed protocols and lots of professional help behind the scenes to help with this service. And it was really interesting to go and see something like that in operation in a festival environment. I think we're a little way away from that reality, perhaps in most of our local festivals, but it's something I think that's really, really, really interesting. What else do we have? Well, okay, here's the drug checking site again, and just I guess it looks hot, right? It was pretty hot. Almost every day was over 40 degrees. The sun was relentless, and pill testing's not a bad line to be in this environment, because we had sporadic air conditioning, I guess. Then back to Lisbon. So Kosmicare, as well as attending the Boom Festival and delivering their services in that environment, also operate a drop-in in Lisbon. And so this is just a bit of a photo of that drop-in. It's a very small little shop front. where people can come in 2 days a week, drop off samples that are later analysed later that week, and you can again obtain some information about those drug samples by phone at a later date. So it was interesting to go there and see that operation happening as well. In addition to the drop-in, they also have a mobile service, and this is particularly targeted, I guess, at some of the more disadvantaged communities in Lisbon, some of the more marginalised communities. So bringing drug checking to those areas of Lisbon that perhaps a little off people's radar. I guess you can see the trip chart on the wall there. A nice lead-in perhaps for the following talk. And then the last stop on my trip was Checkit. So this is an info poster from Checkit. It's talking about MDMA and dosage, and so they operate a drop-in as well, a collection service. The interesting thing about Checkit is that they are probably the most technologically advanced service that I visited. They have parallel liquid chromatography setups. They also use mass spectrometry routinely in their analysis, and they're able to not just do the fixed site collection and information, drug checking type service, but also relocate remotely. Interestingly, as in contrast to the Netherlands, Checkit is mainly based in Vienna, and their ability to operate in other parts of the country is a bit limited by different jurisdictions, which sounds a little bit like Australia, doesn't it? So I think with that, that's sort of my Churchill Fellowship in a nutshell. My job now is to sort of synthesize a lot of that information and write a report. And of course, a lot of the things I learnt on the way visiting these different services, all with their different techniques, can be applied in the local context. I thought I might jump over now to share some of the background to the CanTEST pilot. So the talk I'm going to give today is going to start off telling you a little bit about the history of pill testing in Australia. It's going to move on to some of the testing methods that we currently use, and then I'll finish up with some of the results of that of the pilot, some of which you may have seen, but there's also some fairly new stuff. So let's just start with a bit of history, and of course, Pill Testing Australia, I help them out with their chemistry. I lead the chemistry teams in their pill testing efforts. They mounted the first two trials of festival pill testing in Australia, both at Broome and the Moo, and both in Canberra. And the second of these, interestingly, was evaluated independently by a research group hosted at the Australian National University. So Anna Olsen and her team did that program evaluation. And there's a report that you can find on the ACT government website, which tells you what they found. And largely the results were quite positive. And so on that basis, the ACT government then wrote Festival's pill testing policy. And you can go to the ACT Health website there and download this document and have a read. And this basically tells you how to mount a pill testing service in the ACT, at any rate, in a festival environment. So this is a thing that's a thing now. It's there for the future, and it's not just me that can engage with this now. I guess others can as well. So it's definitely something that's an ongoing concern in the ACT, which I think is a good thing. So I probably don't need to tell you too much of this introductory stuff, but pill testing, what is pill testing or drug checking? And I guess the aim is to reduce some of the harms, maybe to change some of the behaviours associated with drug use. And the way we aim to do that, of course, is to provide some information on the drug contents to consumers who intend to use the drugs. And if they've walked into our festival testing site, then they have the drugs on them. they're in the festival, they're intending to use them, is certainly a reasonable assumption. Of course, pill testing, it's founded on analytical chemistry, and we need to be, really fast, but also accurate in order to describe drug contents as well as we can. Of course, this might not be as comprehensive as you might get in a forensic or toxicology lab with their millions of dollars of equipment, but we can still do quite a lot that's valuable. And of course, the whole point of doing the drug checking is not just to get the analytical result, but it's to inform a conversation between the service clients, doctors, harm reduction workers. So it's certainly more than just a test result. That's certainly the model that we've built in the Australian context. So a little bit about festivals and testing. In the festival days, we were pen and paper, and of course we would record information about the samples that we were testing and the nature of those samples, what they were expected to be, and then our analytical results. These days we've got a bit more technologically savvy, I guess, and again we're being evaluated in the CanTEST pilot in Canberra. And there's a back-end data captures software called RedCap that we're using to collect all of this information, and that I think is going to be very valuable into the future for analysing not just the testing results, but also client responses to survey questions and things of that nature. So stay tuned for evaluations of the pilot that will emerge. Might just flick to the kinds of things that we can and can't do a little bit before I jump into the testing technology. So the way I thought I'd frame this is just to look at some of the frequently asked questions that pop up for the service, and that we've tried to answer on the Directions Health Service website, who are mounting this service. So, for example, how much sample do we need? Well, really only a few milligrams typically is enough of a pill or a powder or a crystal. That's plenty. What can we test? Well, typically pills, capsules, powders, crystals, sometimes liquids. It depends on what they are. We may not be able to test some materials like plant materials and blotters, dilute solutions perhaps. And this is because the methods for these are often a little more involved. And we have some plans to try and address some of these gaps, but there are gaps at the moment, certainly within the pilot context. Nevertheless, if you bring plant material or other materials of that nature, there's still people on hand who you can talk to give you advice about the risks and safe using and things of that nature. We're testing across a wide range of drugs, including opioids and injecting drug use. And so fentanyl is often a question we're asked, and we do use fentanyl test strips to test particularly opioid samples that are presented, which is quite a reliable way to identify this class of drugs. We've done some work on behind the scenes on making sure that's the case. Will the drugs be confiscated? Of course not. This is a free service, it's voluntary. You come and present your drugs. We do have to take a sample, but as I said, it's quite a small one, and then it won't be confiscated. The decision on what happens to that material is up to you. And will alerts about dangerous drugs be released to the public? Well, yes, and I'll show you a couple of those later on. So I thought I'd give you a bit of a rundown of some of our testing techniques, and the first of these is Fourier transform infrared. And this is like fingerprinting in a forensic sort of context. So every drug has its own particular signature or fingerprint, but in this case, it's not a human fingerprint. It's an infrared spectrum, and you can see an example in the bottom of the page there. And we can use that spectrum. We can match it to a library of recorded spectra in order to identify things like MDMA, but a whole range of different drugs. So this works by looking at analyzing molecular vibrations in the molecules. Again, we've got a large library of spectra. We've got thousands of drugs in our library and tens of thousands of substances, many non-drug substances, but tens of thousands of substances. And from this analysis, we get a score that we can use to indicate the quality of the match or the confidence. Now, IR is incredibly robust. highly specific, reproducible, and can distinguish closely related substances. And sometimes it can even identify secondary components in drug mixtures. But it certainly can't delve down and tell you everything about a sample. And a very important point here is that drug analysis is qualitative, not quantitative. And of course, you see the structures down the bottom. Many of you will know exactly what these are already. The spot the difference there is just to, I guess, indicate that in many of these cases, these substances are quite closely related. And so, but we can test these by FTIR and we can clearly distinguish them. So the numbers across the bolder numbers here under the drug names, these are the match scores when we test for these pure substances. And a match of 1,000 is a perfect match. So a match of 850 is very, very high. And we would say high confidence we've identified MDMA. And you can see that's the case for all of these. Of course, if we keep looking down the list of matches, eventually you turn up things with lower scores. So MDMA, lower down the list, score of 400 is MDEA. But we know that anything under about 750 is a little bit suspect. And so we certainly wouldn't call this sample as including MDEA, sorry. So you see, if we use the score, we can distinguish drugs fairly successfully. Just to give you a bit of a picture of what that looks like on the screen, the blue spectrum is the library spectrum, the red spectrum, the spectrum we acquire from the sample. And you can see those lines follow each other pretty closely. There's a really good correlation there. And again, it's very small here, but this match score is 948, very high, so high confidence. The second technology we use at CanTEST is ultra-performance liquid chromatography, photodiode array detection. And this has been this machine has been donated for the pilot, donated or supplied by Waters Australia, who are our analytical partner, and that's a hugely generous thing for that company to do. And what this technique does is it separates different compounds in a sample using liquid chromatography, and then it can detect them using UV visible spectroscopy. So a different spectroscopic technique to IR, but also can give us some information about the identity of drugs. So not only can we identify drugs, but we can quantify 10 of our 10 targeted drugs, and we set up methods to do this before the opening of the pilot. We can detect, but maybe not identify or quantify non-targeted drugs. So we may know that something's there. It may not, if it doesn't equate to one of our targets, we may not be able to identify it. Just some really cartoonish little slides here on how this works. Basically, the liquid chromatography here is like a running race, and different drugs run at different speeds. So you can see that morphine here is on the right-hand side. This is really fast. Something like ketamine is much, much slower, and heroin is even slower than that. So the time it takes to come off this liquid chromatography, we can measure, and that tells us something about the identity of the drug. And so we might get a trace that looks a bit like this. This is our 10 targets, and you can see that they're all nicely separated over time. And you can see the times on the x-axis here. All of these 10 drugs elute in under 3 minutes, and our method's a little bit over 3.5 minutes. So this is pretty quick, and there's a little bit of time between injections. That's about a 6-minute run, injection to injection. And of course, we have to add sample preparation onto the front of that, which takes a few minutes as well. But overall, we can get a result in 10 minutes. If we queue up too many samples, it might take a little bit longer. Okay. So the first thing, of course, that we note is that the different times that these different drugs elute tell us something about the nature of the drug that we've identified. The next thing we can use is the UV visible spectrum. And we can, again, match the UV visible spectrum that we obtain for each of those peaks in the liquid chromatograph. We can obtain a spectrum, we can match them to a library. And it may not look like it here, but in fact, there's 2 spectra here. There's MDMA from our sample, and there's MDMA from our library, and they're perfectly overlaid here. And so this is a really good match for these two samples. So in addition to the time it takes, we can match the UV spectrum, and both of these things give us a pretty good idea, well, let's say high level of certainty that we've identified MDMA correctly. The last thing we can do with this technique is quantify things. So you'll notice that the chromatogram had these peaks that come off that show the different drugs at different retention times, and we can measure the area under those peaks. And if you plot a graph of the amount of substance versus the peak area under these blobs, then you get a linear trend line like shown in this graph. And then what we can do is, for an unknown sample, we can measure the area of the peak in red here. Let's say it's 16,000, and we can trace across and say, okay, this is 67% pure MDMA, or amphetamine in this case, because it's on the right-hand side there. So here's our top 10 targeted drugs. You'll see them listed in the table there with their different retention times: morphine, amphetamine, methamphetamine, MDA, MDMA, PMA, MDEA, ketamine, cocaine, and heroin. And of course, we had to decide on our targets to develop the methods before the opening of the service. And I'll confess that if we were developing our list of targeted drugs now, we might include a few different things as well as dropping out a couple of these. But these are the things that you learn in delivering a pilot program. Okay, so once again, just to recap with UPLC, we can use retention time, we can use the UV visible spectrum, and we can even tell you something about drug purity. So for targeted drugs, we can detect them, we can identify them, and we can tell you how much of them there are. We can tell you the purity. For non-targeted drugs, these may remain unknown, but we can at least tell you that there's something else in there. And that can actually be quite useful information. We're actually at the moment developing a qualitative library of compounds where we can match retention times and UV spectra for some of these non-targeted substances. So at least in the qualitative sense, we can say, well, your MDMA pill has caffeine. So here's a couple of results. This is an example of our analysis, I guess, and this is a sample that we retained from Groove in the Moo in 2019. It was expected to be a sample of MDMA, and here's the analysis. You can see there are three chromatograms here. This just means three different wavelengths of light that we use for the UV spectroscopy, but they also all show a single peak here at this is about 1.6 minutes, and so this gives a retention time match for MDMA. The machine will automatically go away and match the UV spectrum, and we get a good match for MDMA as well. So you can see that in the table below here, and then we can use this free base amount here to calculate the purity of MDMA. So we always report our drugs in free base form. This is just makes it a little simpler, I think, both in terms of developing our methods and our calibrations, but also for detecting when things like salt forms might change, for example. So just to give you an example of MDMA, MDMA is most commonly found as the hydrochloride salt when it's found on the street, and the maximum free base content of MDMA hydrochloride is about 84%. So 77% here is a pretty pure sample of MDMA based on our experience. And we would report this as high purity to the client, as well as giving them the percentage as well. I should just add that there's always some uncertainty in our measurements. So we would probably report this sample as being somewhere between, maybe plus or minus 10%, so 67 to 84, which is the theoretical maximum for the hydrochloride salt. Here's another sample, again, another expected sample for MDMA. Once again, we get a retention time and a UV match for MDMA. And this tells us that we've got 53% MDMA. But if you look across the right-hand side here, you can see we've got a bunch of other peaks. Now, the report says that these are ketamine and cocaine, but they don't match the UV spectrum. So this indicates to us that although the retention time is similar, the time that they elute, they're actually not those drugs. There's something else. And we couldn't at the festival, we couldn't at the time of analysis identify what this drug was. The big peak here turned out later to be this compound in the brackets up the top, dimethocaine, which is a local anesthetic type agent. Don't know why it was there. Not particularly harmful, but it's something that we detected later on by doing some further analysis back in our lab at ANU using gas chromatography. Okay. So I think I'll skip over. We also do fentanyl testing at the service. I'll just one slide, I guess, on this is that it's like a RAT or rapid antigen test for fentanyl. So you just dip the stick in the sample for 10 to 15 seconds. You wait 5 minutes and you read the result. So the most confusing thing about this is that a negative result is 2 lines, a positive result is 1 line, and of course you can also get invalid tests. So just want to remember if you're ever coming across these. Is that so? This is a PDF file. You'll be able to find this on the web if you've got further interest. But this is our first month's summary. And I won't go through all of this, but just to show that we're reporting to the community what's going on. In the first month of our service, we had 58 samples, and we reported on various targeted drugs that were most commonly presented to the service. For example, ketamine here, we had 7 samples that were expected to be ketamine. And in this case, we detected ketamine in only 5 of those. The purities ranged from 39 to 79%. And when ketamine wasn't found, we found lignocaine and cocaine in one of these. Another sample, we identified a ketamine derivative, and I'll talk a little bit more about that later. Over to the right, you can see MDMA, 19 samples. We detected MDMA in 13 of those. You can see the breakdowns for the different types, capsules, powders, pills, crystalline samples, and also the purities. And I will say that the purities of MDMA vary hugely, both within classes, but also across the classes. So it's an interesting one. Where we didn't detect MDMA, we detected some other substances like caffeine, or this BK2CB, which is like the cathinone derivative of 2CB. So an interesting substance there. Cocaine, there's some other drugs, I won't go through them all. Cocaine here was expected in 5 samples. We only detected it in 3, and the maximum purity level was 27% for the 3 that we detected. So pretty low purity. Maybe that's not such a surprise given how far this drug has to travel. And then some interesting ones. This 6-APB compound. This is like a MDA derivative. You can see instead of the methylene dioxy ring on the left-hand side, it's got this furan fused ring on the edge. Rather unusual. Supposedly has MDMA or MDA-like properties when you take it. It was expected in 2 samples, but again, we didn't find this substance. Instead, we found this ethyl methcathinone drug in both of those. Okay, so the last thing I thought I would show you is some other results. So again, if you're interested in our service, please keep your eye on Twitter or the Facebook page for the service, and you'll see occasionally these types of these types of things presented. So this is what we call an alert. It's coloured yellow because it's I guess it's of some concern. It's not a red. It's not a it's not a all hands on deck kind of emergency situation. But it's something that we think the community should know. And so this was an MDMA sample presented in the last month of our service that contained a cathinone derivative called dimethylpentylone. And of course, the cathinone derivative is going to have somewhat different effects, obviously, than MDMA. So some of those things are listed there: elevated heart rate, urge to redose, elevated body temperature, maybe headaches and insomnia. So for people expecting MDMA, this kind of compound might come as quite a surprise. And what you find with our tiles, our community notifications, is also that we provide a little bit more information here about this drug. For example, this one's been known since 2014. It's had a resurgence recently in the US. It's been detected in New Zealand quite recently. It's also fairly commonly appearing in the Netherlands at the moment. And just at the bottom there, we've got some harm reduction information. Last one I thought I'd show you is this one here. Oh, wrong one. I think I might need to open this one. So this is an alert that came out, I think, last week. And this one's a really interesting one. So this is a sample presented as ketamine. It's now happened 4 or 5 times in our service, but it's been determined to be this 2'-fluoro-2-oxo-PCE compound. Now, this is a new psychoactive substance that has only been reported once in the scientific literature. It was an identification. As far as we know, it's never been reported by another drug checking service around the world. And there's no clinical information at all available in the literature or online that we can find. So this is truly a new substance. It's a new ketamine derivative. It's quite closely related to fluorexetamine, if you saw that name on the earlier slide here, but it is distinct, different. And obviously, being a different substance, it could have different effects. It could have a different safety profile. So, of course, this alert is, I guess, for the community who are buying ketamine, just to be aware that this sample is circulating and to perhaps come to our service, get it checked out if you're worried about the potential of this substance being in your possession. So I think I'll finish up there. That's our service in a nutshell, and I'll head back to Nick and any questions.
We do have a few, and thank you very much for presenting on that, Mal. Really interesting results so far, especially to see, completely novel drugs showing up in the recreational market in Australia. So we've got a few questions. Thank you to those who have dropped your questions into the YouTube comment section. You can still do so. And we'll start with, look, there's lots of questions. I'm not going to put them in a logical order because there's lots. What, with all the bad news about fentanyl in the headlines, what is the situation in Australia with things like fentanyl spiked pills? Maybe we should also define where those headlines are coming from.
Yeah. So, of course, you may be referring to the news of the fentanyl bust in Melbourne. This happened back in December. We only learnt of it fairly recently when Border Force released that information. But that was of great concern because it was, over 10 kilograms of fentanyl, which is a lot. This is a really potent drug, and it's a real concern. I think the thing to note is that this appears not to be a big problem in Australia just at the moment, and I think that's a great thing. I know that MSIC in Sydney also do some fentanyl drug checking. We do fentanyl drug checking. We haven't seen anything in the first 2 months, so I think that's great. I think we should be vigilant in Australia. It is distressing if you go to some of the North American drug checking services and look at their monthly reports. Some services in North America, like Canada, the majority of the clients coming into that service are expecting fentanyl. And currently, there are thousands, tens of thousands of overdose deaths in the US associated with fentanyl and other opiates every year. So it's a huge problem. So let's hope we can steer clear of it.
Yeah, thank you for that. And I think it's a good sign, at least, that we haven't seen that, but a particularly concerning one, that the information was held from the community for so long by a service that is there to protect us, apparently, but that is a common problem. I won't get into that. That's my own sort of question, but we have lots, again, from the YouTube section. We touched on this a little bit about plant matter, and as you're running through the various different tests, it looks like I'm kind of guessing that maybe one of the issues is that there are such a variety of molecules in something like a piece of plant material that it just muddles everything up, and it's really hard to find your peaks. That's my guess. But what are the limits? How would you test plant matter for something like, say, a DMT? I'm guessing people are maybe meaning a chaga type sample, which is where the DMT is mixed with other materials. Where are those limits, and how does that work? And you touched on that there might be some solutions.
Yeah. So at the moment, we have limited capacity on site, and we do all of our testing on site to relay that information to clients. That's the way this service has been set up, and so it is challenging. I might just head back to Portugal for a while, where the main technique for analysis was TLC, and you see the same sort of issues that you alluded to, Nick, which is that plant material is extremely complex, and so extracts that are presented are really complex, and it can be hard to sort of pick out the substance of interest, or any adulterants, for example, that could be in there. So that is a big challenge. We have some thoughts to have a look at synthetic cannabinoids. So we know from experience in Europe that there's some problems there, and we expect that's probably also occurring in Australia, where cannabis samples are adulterated with synthetic cannabinoids. And in that case, I think we have the capacity to do something, because these compounds are typically sprayed on the surface. It's not so hard then to extract that by washing it off and analyzing it. So I think there's some potential there. I do think it's a little bit more complicated than our targeted assay at the site. It may take a little longer. So this might be something that we head back to the lab and do with the result presented a bit down the track. And then I think if we really wanted to test plant material, things like cannabis or compounds, including DMT and so on, we might want to do that by gas chromatography, mass spectrometry, and we simply don't have that set up at the CanTEST service at this stage. It would be great, but technically that's not impossible. It's just challenging, and it takes a while. But setting up those types of assays sort of back in the lab would be a way to address those. It can be done, but it's just more complicated, and it's exactly the issue you raised. The number of different compounds in plant material leads to really complex samples, and you normally need some sort of careful extraction and purification and so on to get to the bottom of it.
We actually had a question from the comment section as well on the synthetic cannabinoids, and you answered it in there. But it is, it is an interesting one, along with a lot of these other novel substances, because the trend that we've seen over the past decade, especially the past decade, is that there are more novel substances on the market, and like not just novel, but super novel, not just, developed over the past 30, 40 years. Some of the so-called novel substances from the past were straight out of PCAL or TCAL. So they're 30-year-old substances now. And they were, at least there was a little bit of recording about them. Well, now there's this sort of, confluence of technology and capability that allow people to design chemicals very quickly, molecules very quickly, and produce them very quickly. In fact, before we go on to the next one, I was listening to a really interesting podcast the other day about perhaps the next step in this technological and capability confluence, and that's the use of machine learning technologies in the development of molecules, and the potential to key in certain parameters and manage to say, hey, I want this to bind with X receptor in the brain that they think might cause Y effect, and just churn out lots of chemicals. And this is already sort of what's been going on, but machine learning, I think, would speed that up. Is that at all on your radar? Is it something that concerns you? I don't know.
Yeah,
it's the future.
Yeah. So yeah, there are some interesting developments. There is a so I know of one system where you can input a drug structure, and it will use that structural information to give you a bit of a picture of the likely effect, the types of receptors that it hits, and things of that nature. So I guess you could reverse engineer that in a way to try different derivatives, and think about targeting different effects. I suspect up to this point, the range of substances that we see, the so-called novel or new psychoactive substances, some of them are historical, of course, but some of them I think are just trying different stuff, just making different stuff, sometimes to evade the law. So it's quite curious that some regions around the globe have drug laws that are less broad in nature. So for example, in the Netherlands, they schedule drugs, or they ban drugs individually. And so what tends to happen is that people or drug suppliers will move on to the next drug. They'll move the methyl around and go from 4-methylmethcathinone to 3-methylmethcathinone to make a new legal drug and supply that to the market. Yeah, long answer to the question, but I think that there is a potential there for people to start using some of these technologies to try and design things. I would point out, I guess, that I suspect the results of that are going to be a little bit interesting, because even small changes can have rather large effects on occasion.
Well, yeah, that's it, and that's exactly what we have seen with some of those synthetic cannabinoids or cannabinoid receptor agonists that might be very similar in their molecular makeup, or look very similar in their molecular makeup to a more traditional cannabinoid, and have significantly different effects. It's some potentially dangerous territory, and gosh, you're getting into territory that I'm really interested in here, because it wasn't that long ago that Australia too banned things individually, and I still have questions over whether our drug laws really have anything to do with health and safety if we're defining what is banned based on whether or not it's psychoactive, rather than something to do with a health or safety profile. That's a discussion for another day, because I have another question here, and I think you were touching on it with I think it was HPLC that could do this, but this is the quantitative side. If you want to know the milligram amount of MDMA in a tablet, do you have to use the whole tablet, or are there other techniques that you could use to do that, or to get a pretty accurate guess at it?
Yeah, so we do sample the tablets. So the best, of course, the best information would be if we ground up the whole tablet and took a representative sample and analyzed it. But we do give you a purity based on a scraping of that tablet. there's going to be some uncertainty there about the how homogeneous those samples are, but we can give you an estimate of purity for tablets, and we do that fairly routinely. So there's probably a little bit of work for us to do there. It'd be nice for us to sort of test that sampling technique and just reassure ourselves that we're giving reasonable information in all circumstances. But yeah, we don't take the whole tab. Unlike so in DIMS in the Netherlands, they do submit a whole tab, but then that gets sent to the lab for analysis. So it's a slightly different system.
And plus, I'm guessing that there were maybe some considerations for maybe people aren't willing to give up that much, especially here in Australia where drug prices are significantly higher than in a place like the Netherlands, where it might be a little bit easier to let go of. And you want people to use the service after all. So so talking about the drug alerts that go out, and it's something we're starting to see more in states and territories across Australia. Obviously, those sorts of alerts are coming from information from multiple other services. This is not information directly about the substance. I think you would be the only one in Australia to be releasing something where you have actually analysed the sample. That's the whole point. What would trigger a red alert or a red colouring for a drug that you have tested?
Well, I'll probably just so I think one that would certainly do that for us in Canberra is if we did find fentanyl in heroin or a drug of that nature, something which is obviously potentially lethal and presents a real risk of overdose. So that would probably be a red flag straight away, and the response there would be much quicker. And it would be much broader, and it wouldn't just include a notice to the community, but it would also include information going to health practitioners, paramedics, things of that nature, just alerting them to the presence of that kind of substance in the community. And I guess we have these sorts of conversations all the time about when is a substance suitable for that community notification, like the ketamine derivative or dimethylpentylone, and when is it just someone's substance, maybe not what they expected, maybe caffeine instead of methamphetamine or something like that. So there's lots of debate around when those flags come up, that has to sort of go on behind the scenes.
Yeah, well, I mean, it would be interesting because I've definitely seen some, at least from my perspective, some different parameters being used by, for example, New South Wales Health, Victoria Health, and the sorts of warnings that you've seen. And I suspect that conversation will continue over time because there was certainly one that was discussed at the New South Wales Users and AIDS Association's peers conference that I was at over the past couple of days, and something that we were looking at and really interested in is talking about those drug alerts and how far they are reaching. But we got into discussion about what's the point of them. Especially for one, what's the point? Because one of them, the comments section, sure looked like people were excited to be warned about that drug. So I won't quite get into it. You might be able to guess if you saw the one. But interested in that distribution model. Is it just out through social media? Is it, or do you directly post them to a series of health professionals or lists, or how does it reach the people that it really needs to reach beyond those that are looking to you for the information that you have?
Yeah, so as I said, I think red alerts would be an ACT health process, and it would go out to the hospitals, to the health professionals, to paramedics, you name it. It would go into state. It would go to the other states and territories. So that's a red alert. The yellow alerts are probably of for us they're of low concern, I guess, but they are things that perhaps the community might want to know, right? If you want ketamine and you're not getting it, there's some potential risks there that you might want to avoid. So that's the intention there, and they go out in social media. I guess our modes of communication are developing a little bit, and will develop over time. So, for example, maybe down the track we'll have an app that might sort of push notifications out to those who are subscribed and interested. So there's different ways, but at the moment it's just through social media. So just follow follow CanTEST, and you'll see things pop up. Or CARMA, the Canberra Alliance for Harm Minimisation and Advocacy, post out our warnings regularly, which is great. Yeah, just keep an eye on those, and you'll see what we're seeing, and be informed.
Thank you to everyone who has asked a question in the YouTube section. Really appreciate everybody who is interested in this kind of stuff, because it's early days for a lot of it, and it will hopefully be able to at least give some evidence for why we need to fix the market in even bigger ways down the line. I have a final question, Mel, because this technology at the moment, obviously very expensive. You need trained professionals to be able to do this sort of thing. But I have seen, for example, handheld, I think it might have been Raman spectroscopy devices that are apparently being used by, for example, border police on the spot, so that they can get a very quick turnaround. And there are even devices that can be commercially bought that people could buy for private use. One of the things that you were touching on is the libraries that you require. So you need to match those samples. Otherwise, it's just a bunch of lines. And also that you could only have 10 targeted substances in one of your devices. Does that mean that that's as much of the library it can fit? And are these libraries being developed in a way that is going to be for broad use, or are they going to be commercial arrangements for access, or will it be certain regulations around how it's accessed if it's supported by government? Just I'm guessing, I'm wondering where is this heading in terms of the public ability to access the technology itself and the process itself?
Yeah, so let's start with IR. You touched on Raman, I think. Similar technique. We prefer IR. I think it just works better. We've tried both. It turns out that the libraries that we use, some of them are commercial, so we do have those. But in fact, some of the larger ones are actually free to download. So the Scientific Working Group for Drugs publishes FTIR libraries that you can download and install on your machine. It's not a cheap machine. It's still, $20,000, $30,000, $40,000 to get one set up. But the IR machines we use are incredibly robust, really easy to use. I think they'll be a feature of drug checking in Australia for a long time. In fact, they are in the other services I visited, like DIMS in the Netherlands use them a lot. They've even developed methods to quantify drugs using IR. That's something we'll be looking at in the future as well. If I go to the UPLC, then you're talking sort of another order of magnitude in terms of expense, and that's obviously more challenging for broader distribution. And the other aspect to that is that to do the kinds of things we're doing with quantifying drugs, giving purities, you really need to be sourcing reference materials. So these are pure substances that you use to develop those calibration curves, and that might be challenging unless you've got a friendly jurisdiction that's prepared to license your operation to access those. So we have to go through that process. It's not too onerous, but it will provide a bit of a barrier, I guess, both the cost and the access to those materials.
Thank you very much for talking to us about all of that tonight, Mel. Just finally, I think many people will probably have at least seen or heard Dr. David Caldicott, long-time proponent of pill testing. I know he's got stories from back in the late 90s, or it might have been early 2000s, of his own pill testing over in South Australia. And he is involved with CanTEST, and somebody in the audience was just wondering what Dr. David Caldicott's role is there at CanTEST. Sure, you can Google it, but...
So David's our clinical lead. So he'll often he'll be engaged at every service open. We'll review the data that we receive. So there's analytical findings, of course, but then there's the clinical significance of those findings. Dave's your man for that. So very, very knowledgeable. As you alluded to there, really broad experience in this area, not just in Australia, but overseas as well. So Dave's an integral part of the process. You will have seen him crop up in media and social media and so on, talking about our people testing at festivals, but also the CanTEST pilot. So Dave's very much a key part of the operation.
I've also dropped the URL to go to for more information about CanTEST into the bar down below there. So you can go there and you can find more information about them. You can find them on social media, find that report that Mal showed to us, and more information. So go check that out if you do have any more sort of questions like that. And we really appreciate you speaking with us today about the project, Mal, and good luck with the rest of the trial. I hope that it yields results that we can use in other states as well to hopefully change the status quo. Thank you.
No worries.
Mal is works at Australian National University, interested in medicinal chemistry and the development of new chemical and analytical technologies, and was speaking to us about CanTEST, the pill testing Australia, pill testing / drug checking fixed site operation. So this is something that people can go to with samples that they have got from wherever it is, and get a result back. So it's really interesting stuff. And as I mentioned during the Q&A there, we were discussing as peer organisations at NUA's Peers and Consumers Conference over the past few days, the role of warnings, because there are a lot of different ones, but also how social media, how drug communication works on social media. Here in our audience, we have people who are generally very interested in these sorts of topics, especially ethnobotanical topics. But I suspect many of you are interested in other aspects of substances of the psychoactive world as well. But you'll also notice, if you want to go back through, EGA has really good numbers of people who are watching it, watching our videos in comparison with other similar content. But it is hard to get those massive views, those thousands, tens of thousands, hundreds of thousands. And I know that for most of the social media that goes out from a lot of harm reduction organizations, unless you're doing, spinning a sort of sexy psychedelic angle, which is super trendy at the moment, then it's hard to get the reach that you need. And we know that the numbers of people that might be reaching the information and the numbers of people that are actually taking substances, there's a big difference. So there's a really interesting discussion around that, I suppose, because I was just looking at some of the places on various social media sites that post drug things, and there's a lot of stuff that, if people are well informed, is totally fine. If they're not, could be potentially very dangerous, and there have to be a lot of assumptions made about how well people are informed. So. Yeah. Anyway, if anybody has any thoughts on that topic, I'd love to hear it in the comments section. Also, make sure to sign up for EGA's newsletter. That is at gardenstates.org or entheogenesis.org, which I'll get the moderators to drop that into the chat, and sign up under Connect.